recording. Okay. And then we are going to share the screen. Well, as you see, we continue speaking about general practitioners and working in general practice. And we start with the first slide here. Well, and first I would like to say some words about your previous home task, home assignment that you've done. So you remember that you were given the task to write an essay. The essay which answers the question is the difference in your in working in city, urban, and rural areas in your home country. So everything was okay. Well, I should say that as far as this is an essay, there are some rules that we should follow. First, you should have divided the essay into several paragraphs. Some of the students just have written one paragraph and so didn't divide the ideas. So each paragraph should say about only one idea plus examples. A different idea should be given in the next paragraph. So you should follow this rule. And as for the structure of the essay, it should have the following parts. The first is introduction, where you should have to say what you are going to write about. Then there should be a body, 2 or 3 paragraphs depending on the number of ideas, and you should support ideas with examples, the proof of the idea. And then there should be a conclusion where you summarize what you have written in the body. So, and if you follow this structure, that will be, so there'll be the paragraphs that we need to make, to do in the essay. And if we do some written work like an essay, we shouldn't use contracted forms of words. For example, like here, this is the example from one of the essays. You should say, you are getting like this, the full form of the verb. Or in several papers, I saw like an O of people, which I guess stands for number of people. You shouldn't write like this. You should write the whole phrase. Well, and there are some typical mistakes that I've met in your essays. Let us have a look at them, at the phrases and sentences, and try to guess what was wrong in these sentences. So, Asna, are you here? Asna?
No.
So read the first line, please.
People doesn't believe in.
What is wrong with this phrase? Is it okay? Is it right? Who can help us?
No,
People
ma'am.
do not believe.
Sorry?
Do not believe.
Don't
Do
believe.
not believe in.
Yes. Why? Paula Malik.
People is plural, ma'am. Dozen is singular.
Okay. Yes, we use does with singular in present simple, but people, one person, many people. So this is plural.
Sorry, ma'am.
Thank you. So the next is for Shamisha Shiril. So the next sentence, please. Shamisha, are you here? No.
Yes, ma'am.
Okay. So read it, please.
Typical mistakes. The first one, people doesn't believe in, and the second one is doctors in urban areas are usually more educated in rural areas, and the
Stop
third
here.
one is
No. Stop here. What about the second sentence here? What is wrong with this sentence? Where's the mistake in the sentence? Mhm.
then, ma'am. Then.
Instead of then, what should we use?
Then.
Okay, great, good. The next sentence is for Ramisa. Sharin. Ramisa, read the line, please. Mhm.
It creates a wider scope of treatment.
Okay.
It
What's wrong?
creates a wider scope in treatment.
Exactly, you are right. So we have, so the pronoun it, and this is the third person singular, which requires the final S in the present simple tense. Okay, and the last sentence is for Jan Farvin. Jan Farvin?
Yes, ma'am.
Okay.
The specialty field, money and infrastructure creates a opinion in choosing the working place.
Mhm. So, what can you say about this sentence? Is everything okay in this sentence?
The specialty field, money and infrastructure creates an opinion in choosing working place.
What did you change? I didn't get to. Will you just
The choosing working place.
okay, where's the mistake? Which words are written not in the correct way?
The mean creates an opinion in choosing the right place.
Yes, create. And instead of this article, we should use an opinion, yeah?
Yes,
So,
ma'am.
like here, create an opinion. So, good. So, I mean that you know the rules and it's not a problem for us, but you should be more careful using these structures and using the correct tenses. Well, and now, one of the problems that I came across was just that the students just use the ideas from the internet. And so this is called plagiarism, and we should avoid plagiarism. So you know that plagiarism means writing ideas from any source and not acknowledging that source. So in other words, to plagiarize is to use another person's words and pretend that these words are your own. So some of the students, I mean, you got the information from the internet and you didn't change anything, but some of the students, and how should we avoid plagiarism? Of course, when we say about, for example, how many people, the percentage of people living in urban areas and the percentage of people living in rural areas, we don't know, we didn't calculate ourselves. So we have taken this information from the internet, yes, from some official sites. And so you should say that just according to the ministry, for example, blah, 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 we know that 75% live in urban areas and so on, okay? You should give a link. You may copy work, but you must show that that you have used the ideas from the source, what kind of source. And you should copy, you should say the reader that this information is copied. And there were some examples of plagiarism that upset me. I mean, some of the students just used the easiest way of dealing with the writing essay, like copying the papers of their just group mates. So I read a lot of essays, and I was just, I saw that I'm reading one and the same piece of information several times. I mean that you see that this is obvious that these papers are copied, because even the title underlined the same way, and the same words are used in the essay. It's very bad. So this is plagiarism. You shouldn't do this. And those students who have done this, they got 0 for the essay. There are some students in your group too, yes. Well, and like here, and even the design of the essay is copied. So please be careful with this. This is the individual task, and you should do it yourself. Mm-hmm. And of course, it's hard to just not to use the exact phrases from the internet. So what should we do just to avoid plagiarism? We should paraphrase. Paraphrase is to include the ideas of information from an original source in your paper by rephrasing those ideas in your own words. How does it work? You've read the information on the internet, then you put it aside and you write the idea with your own words. You use synonyms. You change the structure of the sentence so that the words are different, not like in the original source. So is everything clear with the plagiarism and your home assignment?
Yes, ma'am.
No questions. Okay. Now let's go back to our topic. We were speaking about general practice and people working in general practice. And now let us focus on listening task. We are going to listen to some piece of information. And this is a case history. We are going to listen to the conversation between Mr. Bloomfield. Mr. Bloomfield is a 28-year-old civil servant and a locum general practitioner, Dr. Dixon. So we should discuss why the past medical history, family history, personal and social history, and drugs and allergy history are important in medical treatment. First of all, let us focus on some phrases which may be hard to understand, just to focus on them. So we say that Mr. Bloomfield, he's a civil servant, and there is definition for this phrase civil servant on the screen, you see. So this is an employee of the government, like a teacher, for example, or a doctor. These are people who are paid by the government, so they work for the government. And there is the phrase locum GP. This is a GP or general practitioner who stands in for another doctor who is temporarily away on holiday or off sick. So instead of another doctor, locum GP. Well, and Let us move on, and you see here some more phrases. So first of all, we see the notes from case history with some gaps. We are going to listen to the information, and we should complete the gaps with some words. So each gap stands for one word. And to the right, you can see some more words that we should focus on, just to be sure that we understand them. Contributory. This is helping to cause something. Yeah. And precipitants. Well, I think it's a noun, not an adjective. So precipitants are factors which cause something, that come before something, and they cause some event. And I'm sure you know siblings, brothers and sisters. Well, and let us go through the notes here, just to be sure that we understand everything. So you see that there are several acronyms here. The first acronym, which is underlined here, is PC. What does it stand for? PC.
Carol.
Sorry?
Carol. Carol.
Do you remember we were speaking about this at one of our first classes? When a person comes to a doctor and
Practitioner.
yes, what is it?
Ma'am, is it practitioner?
Practitioner and C. Practitioner. Okay. Yes, I mean that when a patient comes to a doctor, what does he say? The doctor asks some questions and the patient answers them, and he or she says, well, doctor, it hurts, it's very hard for me, I'm sick. So what do we call
Personal complaint.
Patient complaint.
this?
Plus
Yes.
personal complaint.
Yes, and he presents his complaints. So PC stands for presenting complaints. Presenting complaints. This is just a fixed phrase which is commonly used in just writing a case history. And then we have HPC. This is HPC. If you have a look at the phrases which I used here in this part of the history, H stands for history of presenting complaint. And then there is PMH, this is past medical history, past medical history, and family history is the last part, piece of information. And so have a look at the notes. I think everything is clear. Now we're going to listen to the conversation between the doctor and his patient, and you should complete the gaps with some words, okay? And when I switch on the recording, you tell me if you hear or not. Let's get started.
Listening to. Good morning, Mr. Bloomfield.
Do you hear?
Yes, ma'am, it's audible.
No, you didn't hear. So I need to go back.
No, ma'am, we could hear that.
So the tick is here. I don't know why. Well, then we move to the slide that we need. Here it is. Okay, one more time.
My name's Dr. Dixon. I'm a locum GP.
Do you hear?
Yes, ma'am.
Yes, ma'am.
Okay. So let's start with the beginning.
Listening 2.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, so do we understand everything? Have we written, have we completed all the gaps? Or do we need to listen for the second time?
Yes, ma'am.
For the second time? Okay.
Listening 2.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think. And then they started getting worse, 3-4 times a week.
Mm-hmm.
It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, let us just ask some students to share the information that they've written down. So in the first part of the case history, presenting complaint under the heading PC, let us listen to Sultan. What did you write, Sultan? Is Sultan here? Okay, so read please. 1, 2, 3, and 4. What was the patient speaking about?
He have a problem with his breathing,
Oh.
breathlessness, and like wheezing his in chest.
Wheezing.
And
And what is missing in number 3? Productive what? Okay, with the white, what is missing in number 4? Who can help us?
white flame, ma'am.
White flame.
White flame.
White phlegm and productive. What produces phlegm? White phlegm. When does
Coughing.
it? Coughing. Yes. Okay, great. Let us listen to another piece of another part of the case history, which is history of presenting complaint. Let us listen to Sinju. Are you here, Sinju?
Yes, ma'am.
Okay. Starting
Attacks night and morning, ma'am.
And
Cough makes patient about dash 3 to 4 times a week. Other symptoms, chest tightness,
Okay.
no pain. History suggests that he had no other illness before.
Uh-huh. Okay, so yes, and what is missing in number 6?
Attacks was at morning and night and morning.
Yes,
So 6
at
every
night.
morning.
Mhm. Okay, and number 9, this is just contributory causes, no known precipitants, we should say. Okay, and
Okay, ma'am.
so in the next piece, in the next part of the history, let us listen to Danish. Danish, number 11.
Yes,
and
ma'am.
read it, please.
History suggests no attacks before.
No, and no attacks before. Instead of before, what should we say? Who can help us with 11? If it happened before, this is previous, right? So no, the history, no history of previous attacks. And in the last number 12, what kind of family history was the doctor speaking about?
Eczema.
Yes, eczema. Mhm. Okay, great. And the question is, what is the differential diagnosis? What kind of disease can we speak about here in this case? Any ideas? Who can share your idea about the disease? So we have such pictures: coughing, so chest tightness, wheezing, breathlessness. Something has got wrong with the what? Lungs, right?
Asthma.
Asthma. Yes, it can be asthma, or so sinusitis, or what? Yeah, eczema, right? Mhm. Well,
Pneumonia.
yes, you're right. Okay, good. Now let us focus on the following. When we speak about diseases, we say that some things can just can be the signs of a disease and symptoms, and we should differentiate the signs and symptoms. Here there is information about this difference. So if we speak about a sign, this is an indicator of illness that the doctor sees, but which is not apparent to the patient. So the doctor sees, the patient doesn't see this. But a symptom is what the patient notices himself or herself. And so it's obvious to both the doctor and the patient because it's rather strong. So, but sometimes signs can be classified as symptoms and vice versa, symptoms like signs. Is it clear? I think yes. Okay. And if we go to the next slide, we can see the list of signs and symptoms in condition A, of condition of a patient. And we should decide whether these are signs or symptoms. Some of them can be both signs and symptoms. So look through the list of conditions and let us listen to Ashwati. Are you here, Ashwati?
Yes, ma'am.
So please comment, read and say whether they are signs or symptoms.
Blocked nose, it is symptoms, I think. And raised temperature can be signs. Tender over sinuses, that is also signs. Headache, worse on bending, that is symptoms. Running nose, It can be both signs and symptoms.
Okay. So, what is said by the patient? This is a symptom, yes? And for example, tender over sinuses, it can be a sign because maybe the patient didn't notice this, but just blocked nose, this is obvious to the patient. Okay, not bad. And so if we move on to the next condition B, let us listen to Tayyip Jabbar. So please.
Raised,
Mhm.
raised pulse, it is a sign. And the second one is the recent vomiting and diarrhea. It's a symptom.
Mhm.
As well as sign else also we can say. And the third one is
Dehydration. Dehydration.
Yeah.
What is it?
Dehydration.
Dehydration, no water
It
in the
is
body.
a sign, I think so.
Mhm.
And the fourth one is abdominal tenderness. It's a sign.
Okay.
And crammy abdominal pain. It's a symptom, I think.
Symptom, because the patient feels it himself.
Yes, yes, ma'am.
Well, you were almost right. Yes. But I think vomiting and diarrhea, this is also a symptom because this is visible to the patient. Okay. So we have about 1 minute. So we should